Hello, and welcome to the Dr. Toomer Talk Show. I'm Dr. Catherine Toomer, family medicine and community health physician and founder of Total Weight Care Institute. If you find this information helpful in any way, please go to my YouTube channel and like and subscribe and share with family and friends if you think that they may be helped by the information I provide. And so, and I have some exciting news. I have started a coaching group for anyone who'd like to join. Essentially, what it is a group for people who have questions for a doctor and they just want to ask. You often see a lot of doctors say, ask Dr. So-and-so. Well, I'm that doctor. And you can ask me and we'll join it. And I will send out, if you send me an email to help@drtoomer.com, what I'll do is send you the link for the group when it is officially opened. It is a subscription and for less than a cup of coffee a day. So it's not going to be exorbitant. I can promise you that. But so if you're listening, say hello and tell me where you're listening from. And if you're listening later, just put in #replay and tell me where you're listening from there. So today I want to talk about fixing your heart before it's broken. This is February. This is, national in the US National Heart Health Month. And we hear a lot about the common things that happen with heart disease. We know about heart attacks. We know about heart failure. We know about all these things that happen to the heart, but do you know why? There's a lot of reasons. Everyone's like, oh, it's because of, poor diet, not exercising. And yeah, that contributes. But there are other things that are not as commonly known that can cause heart disease. So I'm just going to talk a little bit about what those things are. And hopefully this will help somebody. So when you think about the heart as if it's like a house. You have your foundation, you've got your walls, you have your structure, you've got your plumbing, and you have your electrical. And that is essentially what the heart. The foundation are the things that your overall health, the overall things that you do, how much you move, what you eat, what your genetics are, what your metabolic status is, all of those things that affect the heart. And then the structure of the heart is the muscle, the actual muscle itself. What is the muscle? It's smooth muscle. It pumps. And that's its function. And so when you think about the plumbing of the heart, part of that is the fact that it pushes blood out through blood vessels, the plumbing of our body, the plumbing of the heart. The heart itself has its own plumbing, which is its own blood supply. And then you have the electrical. The electrical are the things that make the heart rhythm, gives the heart its rhythm. And that's what you're looking at when people say an EKG or an ECG, electrocardiogram. That's what they're looking at, the electrical impulses through the heart. And the electrical impulses through the heart, through the muscle of the heart, can be picked up. And the things that affect the electrical muscle of the heart is the blood supply to the heart. And so that is what is called a heart attack, when that blood supply has been cut off for whatever reason. And that can get picked up because the muscle, the structure of the heart gets affected. And the blood supply is affected, and then the heart muscle gets affected, and then the pumping mechanism gets affected. And so anything that affects any of those things can cause heart problems. And so we know about some of the more common things, like blockages in the blood vessel. We know about some of the other things that can cause problems, like, smoking, drinking, poor diet, no exercise. But do you know that genetics plays a huge role in our heart condition? And the reason that genetics plays such a large role is mainly because of what happens before the heart. So a lot of what happens before the heart is our metabolic status, our blood pressure, our sensitivity to certain foods like carbohydrates, which can't be, so high blood sugars. And so those things can all affect the heart before you even get to the heart. And stress We know that stress causes a lot of problems to the heart for a couple of reasons. When stress hormones are high, I talk about cortisol a lot, but there are other stress hormones. Like you hear of adrenaline, which is, norepinephrine, epinephrine. Those things are given off during high stress situations. And when they're given off, what they do is they affect the heart rate. They also cause small blood vessels to clamp down. So when you think about your heart and its own plumbing, those are small vessels. So when those small vessels are being affected by high stress, they clamp down. And when they clamp down, oxygen doesn't get to the heart like it should, to the heart muscle. And then that heart muscle starts to die. That is the reason why people who are under chronic stress often have heart attacks. That's why stress shortens lives. That's one of the ways that it shortens lives, by affecting blood vessels that then feed the heart. So that is sort of like the thing that affects the foundation, that then affects the structure, that has affected the blood vessel, that affects the pump, the plumbing. The other thing that affects the plumbing is anemia. So our heart pumps oxygenated blood throughout the whole body. And in our blood, there are red blood cells. Inside of our red blood cells is hemoglobin. Hemoglobin is what carries oxygen around our body. When our red blood cells are either too small, too few, or there's not enough hemoglobin inside of each of the red blood cells, then oxygen being carried to the body is just simply inefficient. And so when the sensors around the body say we're not getting enough oxygen, what do you think gets affected? The heart. The heart starts pumping harder, pumping more, trying to get more oxygen to the rest of the body. The immediate effect of that, if it's just mild, is fine. But when it is chronic, and that happens for years and years, eventually the heart overworks and it fails. So anemia is part of what happens that affects the heart. And I see some questions in there. I will get to them. I'll answer them at the end. So chronic anemia affects the heart because it makes the heart overwork. Sleep apnea is another, because it lowers your oxygen levels. So even just basic snoring, like people's like, well, I snore. Well, snoring in and of itself can be a problem that affects your heart, because it could be related to sleep apnea, which is often related to the thickness of someone's neck. And then there's other reasons for apnea. But if you snore, that's something to get looked into. Just like when you're anemic, if you're anemic, that should be corrected. And so snoring is another, or snoring that may be sleep apnea, which also drops oxygen, which then makes the heart overwork. Medications can do this. There are certain medications that affect the heart directly. Many of them are stimulants, like ADHD medications. Some of them are weight loss medications, like phentermine. Other medications affect the rate in which the heart beats, either fast or slow. Sometimes those are actually helpful. And so there's some medications that are called cardiotoxic. And it's really important that when you take medications, you ask your physician, is this something that affects your heart? Sometimes those medications are required and you have to just kind of adjust. And then other times they could be, the risk is too high and you just don't want to take them. Another that people often don't realize is pregnancy. Pregnancy can be can affect the heart in extreme ways. I myself am a survivor of pregnancy-related congestive heart failure. The problem we have with some of the heart disease of pregnancy is that the symptoms are very similar to the symptoms you have when you're pregnant: shortness of breath, water retention, leg swelling. And so those things can also, but when it seems like something's wrong, always get that checked, because It could be that your pregnancy is affecting your heart. Another that is that happens that people often don't realize is viruses. Any virus, common cold, flu, COVID. We hear a lot about COVID affecting the heart. So viruses are not benign. They can cause what's called viral cardiomyopathy, and it's heart failure. Your heart basically becomes floppy and cannot, the actual structure becomes affected and therefore does not pump properly. And therefore, then it's ineffective. And so these are all things that can affect your heart in ways that most people are not aware of. Now, we know that high cholesterol can. We know that high cholesterol is genetic also. Our body makes 80% of the cholesterol that we make, and therefore there's a huge genetic component. Diet can help. Exercise definitely helps. But often what happens is that usually it's familial, and therefore I know we often blame patients for the fact that their cholesterol's high, when in fact most of it is, genetic, and it's not really their fault. And so when looking at the heart, and then of course when you talk about the electrical, then the electrical part of the heart is all affected by electrolytes, your potassium, your calcium. And so it's really important, and your sodium, it's really important then to make sure that your electrolytes are balanced. When your potassium is off, your heart gets highly affected. It is highly dependent on potassium. And so potassium has a very narrow range of effectiveness. You don't want it to be too low, and you don't want it to be too high. And where potassium becomes an issue is in kidney health. And so that's why kidney health and heart health often clash with one another. And so these are all things that, are not benign, that people sort of just like, oh, I snore, oh, I have anemia, oh, I have this. Those are things that can affect your heart. And it's really important to talk to your doctor about those things, because that are outside of the normal, what is considered normal causes, or the more commonly known causes of heart disease. And I see that there's a few questions, so I'm going to answer them. Can chronic pain, I'm just going to put it up here. Can chronic pain from arthritis affect the heart? So one of the things, chronic pain can affect the heart in that, for a couple ways. One is that it does raise stress hormones. When you're in pain, your stress hormone goes up. The other is not so much the pain itself, but sometimes pain medication can, particularly the ibuprofens, the non-steroidal anti-inflammatories. And the reason is because they affect the kidneys. And when the kidneys get affected, then it can raise blood pressure. And so, yes, it can in that regard. And so it's more of a secondary effect. But anything that causes stress and strain on the body, which chronic pain is, can definitely affect the heart indirectly. I don't know. Okay. The next question says, am I a therapist? No, I do a lot of counseling. And the reason I do a lot of counseling is because I function in what's called a biopsychosocial approach to medicine. And so anytime that anything happens with a person, I always look at their biology, I look at their psychology, and I look at the sociology of what's happening. And so all three things. And so if it seems like I do heavily use a lot of counseling in my practice, because I do not ignore people's psychology and how they're being affected by what's happening, and how their moods affect them, how their mood affects their health, and how their health affects their mood. It's very important. You cannot look at one without the other. But so someone says, oh my gosh, let me see. So Medication I've taken can affect my heart. No wonder one of my medications I took affected my heart rate and made my heart rate go up. Yes, there are some medications that will make your heart rate go up, especially stimulants, especially like ADHD meds often affect the heart. That's a very common one that you see. Even GLP-1s can affect heart rhythm, in fact, affect heart rate. Another thing, though, that really affects heart rate, the most common thing that affects heart rate in a way that's not good, because, obviously exercise affects your heart rate, and that's not a bad thing necessarily. But dehydration, a very common cause of increasing heart rate and also the work your heart has to do, is dehydration. And it makes sense when you think about it, because your heart is a pump. It pumps fluid around the body. When you're dehydrated, your blood levels are a little bit low. Your volume is low. So it has to pump more to get the same volume to the rest of your body. So dehydration is definitely an issue. Dehydration also affects your kidneys. And so when dehydration affects your kidneys, that means your electrolytes get thrown off. And when your electrolytes get thrown off, then your heart gets affected. So you see, it's all connected. There's very few things in the body where one thing happens that it doesn't affect something else. Denise says, hello, Dr. Toomer and everyone watching from Pennsylvania. Hello. Thank you for joining. Any other questions? So if there are any, I don't know if there's any above. Let me go back up and see. Nope, I already answered that one. Okay, nope, hide. All right. So if you have any questions, now's a good time to ask. I know that in the past I have had, pretty long sessions, and I've been trying to keep them shorter for a couple of reasons. One, because it makes them easier to edit and break them down. Two, because I feel that, your time is valuable, and it really doesn't take a long time to get information out. And I like to leave time for questions at the end. The other is part of what I'll be doing. A lot of this information is now going to be presented in my group. I'll be using this time often also to interview other doctors and get good information out there for other people. But I will be mostly concentrating on my group coaching. This will allow me to help many more people at one time. So if you want more information about that and what is coming down the pike, you can write to me at help@drtoomer.com. And if I can get my banner up, I'll put my ticker along the, that's along the top. So it's help@drtoomer.com. And or you can go to my website, which is drtoomer.com, or you can comment after this video and I will see them. If you make comments after the videos on YouTube, I do respond. So if you have any questions and you think of those questions later, you can always write to me then. Okay. So if there are no other questions, and I hope you got some pretty good information, then I will see you next Tuesday at the Dr. TOOMER Talks Show. And I apologize, I forgot to put my theme music on at the end. So you'll hear it next week. All right. Good night.